Here's a chilling fact. Over 50% of people who suffer a heart attack have no prior warning symptoms. No chest pain. No shortness of breath. Nothing. They go to work, hug their children, make plans for the weekend, and within hours they're gone. It's not just older adults. People in their 30s, even their late 20s, are now showing up with clogged arteries and sudden cardiac arrest. And often the first symptom is death. But what if I told you there are medical tests that can predict your risk of a heart attack, sometimes years before it happens? Not just cholesterol tests, but advanced science-backed markers that can reveal hidden inflammation, silent plaque buildup, and heart stress you can't feel until it's too late. In today's video, we're diving into the top 10 medical tests that cardiologists at Johns Hopkins, Mayo Clinic, and the American Heart Association use to catch heart disease before it strikes. We'll count down from number 10 to number 1. And by the end of this video, you'll know exactly which tests could save your life or the life of someone you love. Let's start with number 10, Lipoprotein A, or Lp(a). It's a type of LDL cholesterol that most regular panels don't even check. But elevated levels of Lp(a) can triple your risk of a heart attack, even if your total cholesterol is normal. According to the American College of Cardiology, this hidden genetic factor is present in over 20% of the global population. It's inherited. That means if your parents or grandparents had early heart disease, you may be carrying this time bomb without knowing it. It contributes to blood clotting, arterial inflammation, and silent plaque buildup. Who should get tested? Anyone with a family history of heart attack or stroke before age 55. South Asians, especially, have a higher genetic tendency toward elevated Lp(a). And if you're on statins but still not seeing good results, this could be the missing piece. A blood level above 50 milligrams per deciliter is considered high risk. And unfortunately, lifestyle changes alone don't lower it. But knowing your number helps your doctor decide how aggressively to treat you. Number 9 is a powerful inflammatory marker, high-sensitivity C-reactive protein, or hs-CRP. It measures low-grade inflammation inside your arteries, the kind that silently weakens the arterial walls, making them more prone to rupture. And when that rupture happens, it causes the clot that blocks blood flow to your heart, triggering a heart attack. Studies published in the New England Journal of Medicine show that high hs-CRP levels are a stronger predictor of heart attack than cholesterol levels alone. It's especially useful in people with normal LDL, but who have other risk factors like smoking, diabetes, autoimmune disease, or menopause-related changes. Here's what to watch for. hs-CRP levels under 1 milligrams per liter are low risk. 1.0 to 3.0 is moderate. Above 3.0 milligrams per liter? That's high risk, and inflammation is silently brewing inside your body. Diet, stress, poor sleep, infections, all can raise hs-CRP. But it's treatable, and catching it early can help prevent arterial damage before it turns deadly. Number 8 is the coronary artery calcium score, or CAC score. It's a quick, painless CT scan that takes less than 10 minutes and doesn't require any needles or dyes. It gives you a number, your calcium score, that reflects the total amount of plaque and calcification inside your coronary arteries. According to Johns Hopkins, a CAC score of 0 means you're at extremely low risk of a heart attack in the next 5 to 10 years. But a score above 100? That's a red flag. Over 400? That means urgent action is needed. Here's the scary part. People with normal cholesterol and no symptoms are showing up with CAC scores in the hundreds. Who should get this scan? Men over 40. Women over 50. People with high blood pressure, diabetes, or a strong family history. If you're debating whether to take statins, this scan can help your doctor decide. Number 7 is ApoB, Apolipoprotein B. It measures the number of atherogenic particles in your bloodstream, not just the weight of cholesterol. This gives a far more accurate picture of risk. Imagine two people with the same LDL level. One has a few large particles, the other has many small, dense ones. ApoB can tell the difference, and the person with more particles is at higher risk of arterial damage. If your ApoB level is above 90 milligrams per deciliter, you're in the danger zone. Over 120? That's very high risk. This test is especially useful for people with diabetes, metabolic syndrome, or PCOS, and those on statins but still unsure about their risk. Number 6 is NT-proBNP. This is a hormone your heart releases when it's under stress, when the walls are stretching too much or fluid is building up. It's an early warning sign of heart failure, even before symptoms begin. A high NT-proBNP can predict heart problems even if your ECG is normal and you have no chest pain. It's especially helpful for people with high blood pressure, left ventricular hypertrophy, kidney disease, or unexplained fatigue and swelling. Normal levels are under 125 pg/ml if you're under 75. Anything above 450 suggests your heart may be struggling silently. Number 5 is CIMT, carotid intima-media thickness. It's a simple ultrasound of the neck arteries, but it gives powerful clues about your heart. If the arteries in your neck are thickening, the ones around your heart probably are too. CIMT can detect early atherosclerosis, years before symptoms start. Studies show that increased CIMT is linked to a 3 to 4 times higher risk of heart attack or stroke. It's especially useful in smokers, diabetics, and overweight people over 35. Number 4 is the classic treadmill stress test, also known as a stress ECG or stress echo. Why is it still so valuable? Because many blockages only reveal themselves during physical stress. You walk or jog on a treadmill while doctors monitor your ECG and heart rate. If there are silent blockages, abnormal rhythms, or blood pressure issues during exertion, the test will show it. It's especially useful if you have exercise-related fatigue, tightness in the chest, or shortness of breath. Number 3 is the ankle brachial index. This simple test compares blood pressure in your ankle versus your arm. If the value is too low, it suggests narrowed arteries in the legs, which often indicates heart vessel disease too. It's a powerful but underused screening test, especially for smokers and diabetics. A score below 0.9 is concerning. Number 2 is a surprising but very predictive clue: erectile dysfunction in men. Research from the Cleveland Clinic shows that ED can precede a heart attack by 2 to 3 years. Why? Because both involve narrowed blood vessels. The arteries in the penis are smaller, so they show dysfunction earlier, like a warning light on the dashboard. If you or someone you know is struggling with ED, don't just treat the symptom, investigate the heart. And now, the number 1 test that can predict a heart attack even before symptoms occur: CT coronary angiography. This is different from the calcium scan. It uses contrast dye and advanced imaging to actually visualize the blood vessels of your heart in 3D. It can detect soft plaque that hasn't calcified yet, the kind that causes sudden blockages. CT angiography is currently the most accurate non-invasive way to assess coronary artery disease. It shows narrowing, vessel quality, and even plaque rupture risk. It's especially helpful for people with chest pain, inconclusive stress tests, or borderline calcium scores. It does require a contrast injection and a few minutes of scanning, but the information it provides can be life-changing. It allows early interventions before a heart attack ever strikes. And as a bonus, don't forget your waist-to-height ratio. If your waist is more than half your height, your heart is at risk. Visceral fat around your organs triggers inflammation, insulin resistance, and vascular damage. If you're watching this video, you're already ahead of most people. You're not waiting for chest pain to act. You're choosing prevention. Start with the tests most accessible to you. Even knowing one number, your ApoB, your CAC score, your Lp(a), could give you years of extra life and energy. Speak with your doctor. Share this with someone you care about. And remember, heart attacks are predictable, preventable, and you have more control than you think. Stay informed. Stay healthy, and I'll see you in the next video.